Okay, so now that we've put the electrode on the spot that you chose, now you're going to start having a reading on the screen, and typically it's going to read high and then it's going to drop. And then as it warms up and it opens up the capillaries, it's going to start going up. Now typically for most patients it will take anywhere from 10 to 20 minutes for that to stabilize. When the arrow stops going up and down, then you have a good number. And remember, it also depends on the patients and their vascular problems. Some patients have a whole lot of vascular problems, and it takes longer for the test to do. So it depends on the patient. This can take anywhere from an hour to 2 hours, sometimes more. It also depends whether you're doing just a single limb or a double limb. Okay. Okay guys, now that the number is stabilized already, remember for a normal individual, you're going to be looking at between 70 to 80. You can see I'm pretty much normal at 77 right now. Still reading a little bit. By the way, you want to tell your patient that the site will kind of warm up, and the way it feels, it's slightly irritating, kind of like a slight itch. That's how it feels like. And it's warming up, it's arterializing the capillaries, and that's how it gets its reading. So now let's say that we have our reading, we're happy with that. We're going to start doing the charting. Okay, when we chart our patients right now, on our patient, we're using this form, and it's on triplicate. There's the white that goes into the medical record. There's the yellow that goes with our department, and the pink that goes to the doctor. Okay, each area has a sticker where you should put a patient sticker on it. The PO2 is just 160. You put in today's date, their diagnosis. The clinician is you, whoever you are. Indication for the procedure. The skin description. Skin description is like whether they have open sores, or it's really dry, or it's flaky, or really, moist and warm to touch, or it's very clammy or cold, something like that. That's what you want to write in there. Now for the site, if you're using this machine, you can see that it has numbers 1, 2, 3, 4, 5, 6. So you want to correspond those numbers to where you have your electrode set in. Now sometimes people would just write X's to where they'd say they put the electrodes, and sometimes I'd see them just like this. Now you don't want that, because what actually happens is that if you ever end up in court, somebody might say, well, why did you put it there when there's a patient has a pacemaker there? Why did you put it on a site like that? So you don't want that. So you want to try to at least be as close as possible to where you think you put the electrodes. Okay, because if you're looking right there, that's practically the bone, the shin. You don't want that. So if you're going to be specific, you want it right where you think the muscles are located. If it's in the thigh, sometimes you can put it here in the inner thigh or in the outside of the thigh, inner calf or the outside calf, and on the dorsum. So you want to try to approximate as close as possible where you put your electrodes. If this is number 1, then put number 1 there. Number 2 is right around there. Number 3 is right around there. And number 4, of course, goes in the bottom. So that's how you should label those. You'll put in your room air PO2, which for this site, it's saying 79 for me. And then when you put the patient on 100% oxygen, then you would put whatever number that you end up with at 100% oxygen on this site. So let's say 350. And you don't sign in here. That's the doctor's signature if they're gonna write an interpretation. And the original goes in the chart. The yellow goes in the department, and the pink goes with a face sheet to the doctor. Okay, so now that we're done with the procedure, we're going to discontinue the test. we're going to take the electrode off from the patient. You just twist. You just put that on the side. You can, now sometimes some patients have problems with their skin, so you have to be careful how you take it off. Okay, so you just peel it off, throw that inside, and dry your patient's site. And as you can see, it's a little bit red because it's been arterialized. Now that you've taken it off, you want to wipe down your whole cable, and then you're going to take the membrane off. You take this membrane remover, you press it right, you can see the other gasket already popped off. You just slide it underneath that gaskets, and then you just pop it off. And then the membrane's still there. The gaskets are off, but the membrane's still there. So typically you just take your towel or some sort, and that's what the membrane looks like. It'll come off. And then you just leave this around. You don't want to remembrane it right away. You want to membrane your electrodes before you do your next test, because otherwise they will dry up. Okay? So that's it. Thank you very much.